reason why we do our analysis standing is because we're trying to find where the body's unstable against the force of gravity. The more unstable the body is, the harder the body has to work to keep the body upright. So if we can fix the structural issues that are causing the instability, then the muscles don't have to work as hard. If you try to resist as I push here at C7, see how it's like you're going forward, it's really hard to fight back. If I go one below, resist here, so you're able to fight against it pretty good there. But because this is forward, there's actually no resistance the body can create against any forward pressure there. So that is weak there, and also L5, and we'll identify the other ones as we go. So we'll start with C7 here, Lauren. We'll come on back this way, and then bring the shoulders back and up a little bit. Is it tender here at all?
A
little bit. So step forward just a little bit. If it's tender there, that means the rib cage is collapsed forward. So we're going to stabilize second and third ribs back. Those go right around the shoulder blades, so that little push helps to realign them. And then turn this way here, Lauren. We'll do the same thing on the right side. Good. And then come on back to the wall again. Is that tender still at that same spot? Not as much. Good.
Yeah, a lot better.
So now let's bring the first, we're going to get the first ribs back, so shoulders back and up a little bit. We have a little tap here. Good. So keep looking straight here, Lauren. Good. And turn your right this way. And now if we go back to C7 and push against it, resist here, Lauren. See how you're like solid as a brick wall? I can't budge you there. So now we're going to continue going down the spine, looking for these weak links in the chain, essentially. The goal is to have everything working together super stably, kind of as one, connected unit. If there's any instability, the body's not working as efficiently. Look straight down once here, Lauren, and then straight ahead, and look straight up here. So first we're just checking to see if there's any meningeal pulling or any tension of the spinal cord being locked up on the inside that's causing tension up into the head. So if the head's not moving freely and up and down or side to side, that could indicate that there's something with the scar tissue around the meninges. So look to your right here, Lauren, back to center, and look to your left here, back to center. So you feel a bit of that tightness turning to the left, right? And just keep the shoulders relaxed, let the right side fall a little bit more. There we go, very nice, yep. Come on back again. Yep. Now look to the left here, back to center, a little bit less, right? And look to the right, straight ahead.
A lot less.
Cool. Falling a little bit further. There we go. And slightly, let the body sink. There we go. Head forward again. Let the knees turn down a little bit. Let the body sink. And come on. Mobile and stable the feet are, the less knee issues and hip issues that we have, and also less low back problems. The problem with most feet is that they don't evert or go this way very easily. They typically have more inversion. That's because the bones in the feet have collapsed in this downwards direction, and there's no muscle to be able to pull them back up in a superior direction, which is why we're going to use our tool to actually help with that superior movement. And that's going to help to restore the arches and the mobility of the foot. So we'll start with the right side here. And you can see what that does is it creates a little bit more mobility going both ways. So that'll also help bring the knees back into proper alignment. Oftentimes with anterior pelvic tilt, the knees will start to turn in, and then the feet will collapse even more. So we're essentially helping the body to reestablish the proper biomechanics. So it's here. See, so now we start to their head here. Good. So a little bit of push there. Cool. And just checking leg length. A little bit short on the left side. Yep. Now we're going to get the ribs stabilized. So when things are forward in this forward posture, our ribs can also travel forward, and that limits our breathing. We can't really fully expand our rib cage, so this will help to improve that. Let's bring your hands to your sides here, Lauren, and then take a deep breath in, all the way out. Good. Good. So we're just going right down that sternocostal junction right between the sternum and ribs. Breath in again and out. Yep. And big breath again. Let the rib cage expand as much as you can. Nice. And at this point, do you feel like you're laying pretty flat right now, Lauren? Like flatter than you normally would?
Yeah.
So ideally, when the body is stable, there should be no gaps. When we're laying flat, everything should just be able to kind of relax into the table. But a lot of people have trouble sleeping on their back, or they sleep on their stomach because their body is so twisted up. Lift here, drop the arms and look up a little bit. And then take a deep breath in here. Yep, so no wobbling. Feel like you're like unnaturally still almost.
I feel so good.
Yeah, that's awesome.
Yeah, like everything feels really good.
Yeah, we just fix only what your body cannot fix on its own, and the body does the rest of the healing. So, yeah, it's pretty cool.